Okay, well, good afternoon. We'll start our briefing on our COVID information. I want to welcome everybody here. And we'll get started. City Manager Peter Zanoni will come with the statistics and the data for today, and then Annette Rodriguez from the Health District will be here, and the judge will either be here live or on video, one of the two, as far as we know. All right. Well, one, we want to say thank you for everybody that being in compliance and that is, and those that aren't. We'd ask for you to get in compliance with our masks and paying attention to the business requirements. But today I want to hit on something that you don't think has any correlation between COVID and census. But there's a huge correlation between the census and COVID. And if you know, right now we're in the process of taking the census, and they're going to, you've still got time if you have not provided the information and registered with the census to do that. We ask you to do that. We want to know exactly the number, the head count that we have in Nueces County, because that is extremely important. And they're, you know, if they're going to go through the end of September, and then I think that's when they're going to quit either knocking or calling you and just trying to get you to sign up. So please, please, please respond to the census. And you're asking, well, why is that? Well, the reason we need the census is when the federal government divvies up money throughout the United States, they do it on a per capita basis. And the money that Nueces County got, and then money that Austin got, Houston got, anybody in the United States got, they base it on the population that they have on record. And I'm assuming it's what the basis of the census was, or whatever adjusted numbers they have, but it's based on census information. And so everybody that you register counts for that allocation. And so, for instance, in Nueces County, the Corpus Christi and the Robstown and Agua Dulce and Port Aransas and Robstown, all the cities in the county got an allocation, and then the Nueces County judge got an allocation for the unincorporated areas. And you put the two together, it's approximately $18 or $19 million, and that's based on the population of Nueces County. And so if we'd have had, you know, another 50,000 people, it could have translated into maybe another $1 million or something like this. And so, and that's used, the census is used for CDBG money and for many other federal distributions that come to cities and counties for different programs that the federal government supports. So I want to take this opportunity to encourage you to get signed up for the census, and so that we can plan that allocation. And the reason that's on my mind is this morning at 8 o'clock we had what we call the Big City Mayors conference call, and the topic this morning was the reimbursements from the federal government and what the next round of reimbursements could be. And one of the basis is that they're going to be coming back for it, and they gave an outline of information that we have to provide for them, and the city manager and his team is putting together the information for the city of Corpus Christi. The judge and her team is putting the information together for the county. Is they want to know what our budget and income was for the end of fiscal year 19. They want to know what it's projected to be at the end of fiscal year 20, and what we think we're going to be looking at in 21, and in terms of what those costs related to COVID are. And so that is going to have a big bearing on the allocation that we get. And so we want to be able to identify the expenses that we've incurred, trying to keep this community well and healthy. And so your help, both in the census, that will help us not only in the COVID reimbursements and allocations, but in others throughout the next decade. They don't take the census but every 10 years. So whatever numbers they get at the end of this census period, that's good for 10 years. So we really want to encourage you to participate in that as well as this. And we're hoping within the next week or 10 days, the city staff under the leadership of the city manager will have those numbers of what we've spent to date, what we anticipate to spend by the end of December the 30th. That's the end of this year's allocation, and our money has to be spent and obligated and submitted for reimbursements to the state of Texas by December the 30th. And so we're trying to put that together. It's hard to know because depending on how we're doing with our numbers, what our hospitalizations are, the number of cases we have, and other things, because a lot of our expenses are tied to the cost of the testing materials, as well as the first responder costs, the overtime for firemen, policemen, EMS, and that sort of thing. And so it's critical from a financial standpoint that we get reimbursed as much as we possibly can from the federal government for the expenditures. They just don't send down a pot full of money and say, here, boys, go spend it. You have to submit for reimbursement, and you have to document your expenses. And so you don't have it's not a pot of gold sitting here for us to go spend. We have to spend it on what we need to do, and it's qualified, then we can get reimbursed. And that goes a long way in terms of saving tax money and others for the rest of our budget. So I can't stress that enough, but I think you'll respond, and I hope you will. But they're going to be continuing that, but it's going to end at the end of September. And so in terms of the taking in the information, then I guess they'll compile it and put their reports together. So at this time, I'd call on City Manager Peter Zanoni to come and give us an update on the numbers. And then Annette will be and make some comments. And then the A&M Islanders, is that right? Islanders, that's correct. I didn't want to call them the A&M Aggie, Texas, but the A&M Islanders. They'll be here to give us their report. Hopefully the numbers are good. I've not seen them, but one of the encouraging conversations that we had this morning, there were two parts of the conversation. That one was very encouraging, and one was had some camaraderie. The encouraging part was that we got reports from El Paso and from Lubbock that their hospitalization rates have really begun to drop. And I think one of them even said their hospitalization rate today is about what it was back in about April or May, which was really encouraging. And so I'm looking forward to our numbers. I hope our numbers continue to come down. The other thing that we all had in common, which isn't a positive, but at least we know we're not in it by ourselves, is that they were as frustrated as we were or are in getting these data dumps from the state on the numbers. And they've all expressed, when the governor comes to their town, expressing their frustration and the timeliness of those reports. So hopefully we'll be making progress on that. Hopefully we won't have many more, if any, data dumps, but we want to be as transparent as we can and give you as much information and keep you informed. So Mr. Zanoni, if you'll come. Thank you.
Quiero primero agradecer a las personas que han estado cumpliendo con las órdenes. Hoy quiero tocar el tema del censo y el COVID, los cuales están relacionados. El estar contado es de suma importancia, así que le pido que responda al censo. Es importante ya que el condado recibe ayuda federal basada en el número de residentes que habitan en este condado. Así que cada persona registrada va a contar y nos va a ayudar de manera económica, así como para otro tipo de programas federales. El número de personas registradas en este censo va a ser efectivo por 10 años hasta que se lleve a cabo otro censo. Nuestros gastos estarán basados conforme al número de personas hospitalizadas, entre otros factores. Así que es importante contar con el número veraz de personas que residen en el condado. A continuación va a dar su reporte el administrador de la ciudad, Peter Zanoni.
All right, thank you, Mayor. Good afternoon, everybody. I'm Peter Zanoni, Corpus Christi's City Manager, and I'm going to provide you an update on our statistics, the number of new cases, talk to you a little bit about those data drops that we have been getting, and make sure the community understands what they mean and how they impact the numbers, mostly going backward. And then talk to you about hospitalizations, those that are in ICU, and then the number of deaths, and that'll conclude my presentation. So let's begin with the chart that shows the number of new cases for today. And so today being 8/14, the chart should be coming up any moment. We're reporting 89 additional cases for today that are being reported for today from hospitals and our lab and other institutions that give us information. So you haven't seen the charts, although we're providing the information on our webpage. You can see for the past couple of days, the numbers have been relatively low, especially compared to about a week and a half ago. We had a 308 number, but if you take that out, you can see the numbers are looking much better than what they have in the prior week and weeks. This graph just shows a couple of weeks. On the next graph, gives you a little more perspective in terms of some of the out days. But we did receive another small data dump today from the state, 35 additional cases, and I'm going to show you how those impact dates in the past or counts of new cases in the past. So this number today, the 35, is on top of the 89, but the 35 is for the dates of June 27th through August 11th. And so the state continues to catch up, and these data dumps or data drops are case loads or case numbers, but they have all been in the retrospect. So in this case, the 35 that we got notice of today, those cover the dates of June 27th through August 11th, so in the past. And then this next graph will help to explain and kind of puts into context the last 6 large data drops that we got from the state. You can see them up here, or maybe you can see them. But there were 6 in recent times, including today's. And so July 31 was a pretty big drop of 555 cases. August 9th, we had 715. August 10th, 444 cases were given to us on that day. And then August 12th, another 400 cases. And when they were given to us on that day, it doesn't mean that's the number of cases that were confirmed positive on that day. That's just when we received the information from the state on that day. And then August 13, it got better with 87, and then 35 data dropped in August 14th, which is today. So 2,249 is the total number of data drops. And you can see those numbers in the yellow on these blue bars here. So the blue bars are the cases that were confirmed around that day, that were confirmed on that day shown. And typically the test given to the person was that day or a few days prior, maybe a week prior in some cases, depending on who was taking the test. And so they're pretty much real time, especially if we do them at our labs. When we do our drive-through testing sites, we can process pretty much the whole testing site that day, and people know that day if they're positive or not. That represents the blue bars. And so the yellow lines, or the yellow bars on top of the blue bars, are the data sets that we're getting in these 6 events, distributed back in time when the person was notified to be positive. Okay, so we just want to point that out to you. Okay, let's look at how we're doing in terms of recovered cases. And so the orange slice, or the reddish-orange slice in this chart, shows active cases to recovered. And we're making a little bit more progress here. We're at about a 50-50 split in terms of active persons with the virus versus those persons that have recovered. So about 8,130 persons recovered, and about 8,120 persons that are still active with the virus. So that's pretty close to a 50-50 split. There's 277 deaths shown in the yellow slice at the top of this graph, and we'll talk about deaths here in a moment. The number of hospital stays for persons that are recovering in the hospital that need more assistance than at-home recovery is going down slowly. You can see the graph here, a slight decline. Yesterday we had 259 persons in the hospitals here in Nueces County, and today that number is the same, 259 persons in the hospital. And then of that number, of the 259, 102 are in the hospital and recovering in ICU. They need more intensive treatment. That number also is the same as yesterday's, so 102 persons yesterday in ICU, and that number remains the same. You can see it's coming down from a high on August 7th of 136 persons in ICU, and so we're down to 102, so a pretty good drop in terms of persons needing ICU. but we need that number to improve still even more. And then number of deaths, unfortunately, there were 7 additional deaths that are reported today. And so yesterday we were reporting 270 deaths. With today's 7 additional reported deaths, we're at a total of 277 deaths in Nueces County since the beginning of counting deaths related to COVID-19. And then this final graph is one that shows us our trend line, a 7-day trend line, averaging the average 7-day trend is shown in the red line. And the good news is, and we're gonna see how confirmed this is by Dr. Bird's presentation, who'll be coming up momentarily, is that we've definitely reached the peak and we're coming down now, which is good. And what we want to do is sustain this. We don't want it to go back up for numerous reasons, to include potentially school, persons feeling more relaxed and going out more, saying, okay, we don't have to wear our face mask anymore, and not social distancing and that type of thing. So we need this to come all the way down to 0 again. And that's the goal for the community and our health professionals and everybody else that's working this. So the 7-day average, the blue bars, by the way, in case you haven't been following us, are number of daily counts of new COVID virus cases. That's in the blue bar. And then the red graph line is the 7-day average. And so today, the 7-day average is 124 new cases every day. That's what the average is based on the data. The last time we presented earlier in the week, it was 222 or so. So we've dropped the 7-day average by about 100 new cases a day, which is a positive sign. And the goal, though, is to drop it even more. It should be down to the 0s and the 2s and the 3s, or even just 0s. And that's going to take more effort by the community and by policymakers and business leaders across the community. Okay, so that concludes my presentation. We're going to have Gabby translated into Spanish, and then I believe, Annette, you're coming up next. And then we'll have Nueces County's Judge Barbara Canales as well. Thank you.
En las últimas 24 horas se han reportado 89 casos confirmados por el coronavirus, más 35 casos reportados por el Estado, casos que fueron llevados a cabo entre el 27 de junio y el 11 de agosto, haciendo un total de 16,527 casos. 8,130 pacientes se han recuperado por completo, 259 continúan en el hospital, 102 personas se encuentran en la unidad de cuidados intensivos, 8,120 son casos aún activos. Hoy se reportan 7 fallecimientos. A la fecha, los fallecimientos totalizan 277 personas. Afortunadamente, la tendencia por casos positivos continúa declinando. El promedio de casos positivos en los últimos 7 días es de 124, o sea, 100 casos menos comparado a las últimas 2 semanas.
Good afternoon. Annette Rodriguez, Health Director. Worldwide, national, state, and local level COVID-19 response has truly been a remarkable feat. In Texas alone, almost 4,282,000 PCR tests have been reported as processed in areas such as hospitals, local health departments, and commercial labs. Almost 521,000 cases have been confirmed as positive in Texas. We are also approaching over 9,600 deaths in Texas. With this tremendous number of tests being processed, systems like the National Electronic Disease Surveillance System that we call the NED system, it's the system where everyone in Texas reports all communicable diseases, are being inundated with the tremendous amount of data. As more and more vendors and laboratories that were not conducting these types of tests came on board to fill the need for COVID-19 testing, the system was not able to successfully process new laboratory reporting formats and caused the data to be delayed. As the technical teams worked to resolve submission errors, a backlog of lab results developed and only became evident once the submission errors were resolved and the files were successfully processed. To facilitate contact tracing, a new system was put in place, which came to be known as the Texas Health Trace. As this new system processes these lab reports, we and many other counties are starting to receive the large amount of cases through the Texas Health Trace that City Manager Zanoni mentioned. The import of the large amounts of lab results was due to the backlog of cases that were not processed in the old system. This sudden input of large data caused all the cases for Nueces County that were part of the backlog to suddenly appear in the Texas Health Trace. As we work through the new system, we ask the public to bear with us as we continue to ensure that the numbers we are reporting are not duplicates. You may also see edits to numbers as we work to make sure these lab reports are placed on the right dates. We continue to strive for transparency and accurate information. All of us in public health have a vested interest in our community, and we will continue to strive to build confidence and trust. Continue to practice non-pharmaceutical interventions, wash your hands often, social distance, wear a mask when out in public. Together, we can stop the spread of COVID-19. Stay well, stay protected, and as always, stay informed. Thank you.
A nivel mundial, nacional, estatal y local, la respuesta del COVID-19 ha sido verdaderamente una hazaña notable. Solo en Texas se han reportado casi 4.282.000 pruebas moleculares procesadas en áreas como nuestros hospitales, departamentos de salud y laboratorios comerciales. Casi 521.000 casos se han confirmado como positivos. Los fallecimientos en Texas suman casi 9.600. A medida que se incorporaron cada vez más proveedores y laboratorios que no estaban realizando este tipo de pruebas para satisfacer la necesidad de las pruebas COVID-19, el sistema no pudo procesar con éxito nuevos formatos de informes de laboratorio y provocó que los datos se retrasaran. A medida que los equipos técnicos trabajaban para resolver los errores de envío, se desarrolló una acumulación de resultados de laboratorio y solo se hizo evidente una vez que se resolvieron los errores de envío y los archivos se procesaron correctamente. Para facilitar el rastreo de contactos, se implementó un nuevo sistema que se conoció como Texas Health Trace. A medida que este nuevo sistema procesa estos informes de laboratorio, nosotros y muchos otros condados estamos comenzando a recibir grandes cantidades de casos a través de los sistemas Texas Health Trace. La importación de la gran cantidad de resultados de laboratorio se debió a la acumulación de casos que no se procesaron en el sistema anterior. Esta entrada repentina de grandes datos provocó que todos los casos del condado de Nueces, que formaban parte de la acumulación, aparecieran repentinamente en el Texas Health Trace. Mientras trabajamos en el nuevo sistema, le pedimos al público que nos tenga paciencia, mientras continuamos asegurándonos de que las cifras que informamos no sean duplicados. También puede haber modificaciones en los números mientras trabajamos para asegurarnos de que estos informes se coloquen en las fechas correctas.
Okay, good afternoon, everybody. Barbara Canales, Nueces County Judge. In just a moment, I'm going to have an easel set up behind me, and I'm going to use a few visual aids. You'll have to forgive. They're not the best, but I'm going to make them available to the press, and I'm even going to be able to, point out whatever you need a little bit better visual on. The two visual aids that I will be using are one of the beach access roads for Port Aransas, and the second will be the beach roads for Padre Island. I've spent all day at the beach and at coastal parks, and we've been working very hard to get the damage assessments that we so desperately need so that the state of Texas can meet their threshold of $39 million worth of damage so that we would be eligible for public assistance. Without that public assistance, you and me and everybody that's a taxpayer here is going to have a burden, a big burden, because the damage that was done in our coastal parks is severe. The erosion to the dune line and to our beach is almost hurtful. And quite frankly, Mother Nature does take its course on these types of events, disaster events. And so today I want to visit with you a little bit about that second disaster because it has an interconnection to the first. Before we go here, let me make my remarks, and then we'll come to the visuals as it makes sense. And so that you can hear me, let me remove this. And let's talk about the beach curfew and the access orders. As many of you know, the current order is effective through Monday, August the 17th. And many of you have asked, what next? And I want to start with what has not changed. What has not changed is exactly what you just heard Director Rodriguez talk about. This COVID-19 is still very active. This virus is very active in our community. There is no cure. There is really no standardized treatment. We do the very best we can in the community with the amazing infectious disease healthcare specialists and critical care specialists that we have. But the fact of the matter is there's no true treatment that's standard, that works on everybody. And as you all know, there's no vaccine. And it's a respiratory virus that's so easily transmitted, highly contagious, and with a transmission rate that varies in our own community. And many things we have done to help prevent the spread. Look, we started back in April, didn't we, with a drastic measure called a stay-at-home order. We have transversed that all the way to the governor's plan to reopen Texas, but it included really important measures like reducing crowds in public places, actually opening bars and closing bars back again, limiting restaurants and then limiting them again, and affecting everything from museums to venues to gatherings of less than 10. We've implemented operating guides for almost nearly every single business in Nueces County and activities that range from salons to gym to retail stores. And all of those things that we did to prevent the spread. And many things that we've done were focused at improving capacity, including restrictions on elective medical procedures that the governor issued to conserve medical capacity for COVID-19 patients. Here in Nueces County, we worked with the health department to create a COVID clinic, but mainly because Amistad Health Center stepped up to the plate to make this possible. And we've established recently in Commissioner's Court just this week the mechanism to be able to have a contract with HCA to establish an alternate care site, putting forth a plan for our future to secure those types of medical beds that we know in a surge will be vital. We've created management platforms for patients to be able to track and monitor cases around our county, and we are going to be launching those in the very near future. Now let's go back in time a little bit. I remember it. It was the third week of June, and it was actually June 22nd, and we had a really big spike. And that came on the heels of Memorial Day when our beaches were absolutely packed, more so than any of us can remember in a very long time. And on July 1st, Governor Abbott issued a statewide mask order and, remember, closed the bars and limited restaurant capacity. And right after that was July 4th weekend, and we had our very first beach order. And that order lasted from July 3rd to the July 7th time period. And we had a curfew for 11 days. But guess what? The numbers kept climbing because we had started our sins, if you will, from the weeks before. And we needed to find out what we could do in our toolbox. And our deaths, which often lagged infections, continued to climb. We ran out of space in our morgue, in our ICUs, in our emergency rooms, in our urgent care clinics. And the second beach order was born on July 15th, and it was renewed on July 31st to go through Monday, August 17th. And then, of course, there was a special beach order regarding Hurricane Hannah to keep pedestrians off the beach during the storm as it rolled its way towards our coastline. But the infection curve began to flatten. And I started to see, along with all of us, that the curves flattening were positive. We were still unhappy with the amount of cases. We couldn't rejoice as we saw our fellow citizens die. But we knew that something good was happening, that there was a change of behavior, there was a change in mask wearing, and there was a reduction of tens of thousands of people to our areas. And although those curves started to flatten, I need you to know that the Hannah disaster has created a dangerous beach in another way. And there is much debris that needs to be removed. And we also have strained our first responders in many, many ways with COVID-19, from police to sheriff, constables, EMTs, ESDs, et cetera. And many, many have been exposed to the coronavirus and had to have isolated. But in general, our first responders have been on the front lines, and some of them have caught this virus, and sadly, some of them have died. And so here's the bottom line, is that I believe the beach order helped flatten that curve. I believe that it helped to save lives. I believe that it has shown itself to have made a major impact in reducing the amount of people coming to our area, which we know from not only traffic counts, but cell phone data. And we believe there is such a thing as a cumulative effect from all of the things that we're working on together at the same time. That Operation Kitchen Sink, where you throw everything at it so that it will not come in and invade you in the numbers that we had. And I listened carefully to Peter's numbers. And let me share with you what I think is impactful. If you just take from July 31st, when that new beach order got put into place, we've had a 27.6% decrease in hospitalizations. 27%. In my mind, I thought if we could, in emergency management with this beach order, take it down 20%, that would be a tremendous feat. On July 31st, there was I'm so sorry, that first number I gave you was, yes, total hospitalizations. On the 7-day average, just looking at the 7-day, we've been able to reduce cases by 44%, ICUs by 25%. And every category can be looked at and see that there is no doubt that all of our efforts, all of these cumulative effects, haven't just flattened it. We flat out are sending it down in the right direction. But look at the cost. Look at the death rate that we've had. When we started this first beach order on July 15th, there were less than 20 people amongst us that had succumbed to this virus. Now look at us at 277. Everything has a price. So I believe that this beach order has served its purpose. It's reduced the massive crowds at a critical time in our period. It's been in effect for over, 5 weeks now, not counting the July 4th weekend. It has had a major impact in reducing the massive crowds while we were experiencing a massive increase in infections, hospitalizations, and deaths. And it doesn't matter whether you agree or disagree. Let me read that again. While it was in effect, massive crowds were reduced, and we experienced while we were experiencing a massive increase in infections, hospitalizations, death. And so, why not just leave it in place? Because I said there would be a lookout point. And I want to make certain that we always have the tools in our toolbox to react to what's happening around us. There is a balancing act that's required in government. And that balancing act is not only to protect public health and safety, but also the freedoms that we cherish. We have uniqueness here in Texas with Open Beaches Act. We have uniqueness in that we have a general land office who looks to make sure that the reasonableness of our orders in emergency management are being adhered to. So I'm going to be issuing a new order effective Monday morning, and it is not even in my hands yet, but sometime between now and Monday morning, I will be, and vehicular access is going to be restored, but there's a lot of ifs, and I mean a lot of buts, and let me get to those in a minute. But there will be a nighttime curfew in place. And that's actually the same curfew that exists right now. And keeping the beaches empty at night are very important as they relieve the burden on our first responders, which are already strained. And I'm going to keep this order in place, and I'm going to modify it for the interest of health and safety and debris cleanup permit. And I will tell you that I will always be monitoring what is happening in our community, in our hospitals, in our ICUs, in our positivity rate. And at any time that we believe that we are not moving that needle down, we will gather together, as we always have in emergency management, with those that help us make the best health care decisions, which is our health authority, our health department, and all of the hospital providers. I want to encourage everybody this weekend to respect the order that's in place. I want to encourage you to visit our beaches responsibly, to practice social distancing, keep your family safe who live in the same household with you by practicing social distance. Wash your hands, bring sanitizer, wear your mask when you can't social distance and you're not swimming or in the water. And when you come and go to the stores, to the to the grocery stores, to the convenience stores, to the gas stations, to the restaurants, practice all of the necessary hygiene rules that have been laid before you so many times. It could save your life. It could save your daughter's life, or your son's life, or your mother's, or your father's. We all treasure our beaches, and my hope is that other mitigations that we've put in place over the last 4 weeks, 5 weeks, have bought us sufficient time to slow this spread of the coronavirus. And while we have a statewide mask order and other operating protocols, you're going to have to keep minimizing those public interactions as much as possible. We're entering our 6th month of this pandemic, and it looks like we're going to be living with this virus for the foreseeable future. And I want to say thank you and how much I appreciate the sacrifices many of you have made, and I would ask that you continue, again, to respect that the order is in place this weekend, and please allow us as a county to become unified, to restore access where it's safe on Monday morning. And now I'd like to move and show you exactly what will be open and what will not be open. Let's start first with Port Aransas. So basically, all of the operational beaches, Cotter Street, Beach Street, Lantana, of course, Avenue G, everyone uses that one, Sandcastle, and 1A, all will have parking lots very close to the beach. In the past, people have been parking on the sides of the street, and not always, but in many cases, last weekend, notably, there was not only traffic congestion, but an inability for emergency vehicles to maneuver. We met with Port Aransas, our emergency management teams, we each have one, worked all week long to create protocols that will benefit public health and safety. And so all of the areas that are in red with the different access roads will still be closed for this weekend and will reopen on Monday. However, this weekend we've established at each of these access roads closest to the beach essentially a parking lot effect that will allow people the ability to be closer and not create any traffic jams or unsafe conditions for people. I hope this will also help the residents in Port Aransas that have been oh so very tolerant of people parking in front of their homes. This is the scene at Port Aransas. Port Aransas did not have the type of debris that we experienced further down the beach or the damage to their piers like we experienced at Bob Hall. The conditions are completely different. Okay? Thank you. This is a map of the Padre Bailly arena. Wait, let me double check. Yes. just remembered I could do that. Okay, so here, the one that everybody kind of knows is Access Road 4. Access Road 4 will remain closed until we can get it open. Since Hannah, it was a very large berm put up of sand, and diligently since Tuesday, they have been working to get this berm down. I was out there today. It is so much sand. You cannot, even if we work all weekend long, this will not be open until sometime mid next week, okay? Access 4 will not be open on Monday because there is still too much Hurricane Hannah sand to be moved on Access Road 4. Here is our park entrance here. Access Road 5 will be open. Access Road 5 will be open on Monday. Windward Drive will be open. So there will be able to be a loop, if you will, of ingress and egress from Windward, okay? Well, actually, that's Whitecap, really. Windward Drive crosses it. Whitecap, all the way to Access Road 5. From Whitecap to 5, you'll be able to make a loop. But essentially, that's it. And the reason I say that's it is the only other availability to you is to come down the main park entrance, which some of us know as Billy Sandifer Drive, and you will be able to go north on the beach, but not south. So I guess, as access roads are named, it will be Whitecap to 5 open in a loop, 4 will be closed, and the main road only north will be available. Why? Because south from Bob Hall Pier all the way to Pins, there is a debris field like you cannot imagine. And we will need all week long, and all of you beach cleanup fans, to come out and assist us. This weekend, we will be working with a working group that I put together that will help create the logistics for a massive beach cleanup that will encompass a 7-mile stretch to clean up our beach, so that inevitably, hopefully in a week or so, we will be able to access south of Bob Hall Pier all the way to Pins. Now, as you all know, that involves multiple jurisdictions, ours and Clayburgh, and we will be working with our friends in Clayburgh to achieve our goals. And so, while the vehicular restriction removal will be achieved on Monday, Mother Nature's restrictions are still there. And I cannot tell you we can get it done in a week, but that would be a goal. So at least for a week, and possibly more, a good substantial amount of your access roads are still closed because of the second disaster that is Hurricane Hannah. I will make certain that all of this is delineated for you on our website. I would ask for just a little patience as I have been out there all day, and I want to thank Scott Cross from Coastal Parks for really helping us come up with a very effective plan for the future weeks. In order to address vehicular congestion and safety issues this weekend, while the access roads are all closed, Director Cross has allowed for cars to basically get a little closer to the beach, and you'll be able to see that adjustment over the weekend. But make no mistake, the beach orders were designed to make it such that we were restricting people from coming in because we were lessening the thousands and thousands of interactions that we were seeing. The Memorial Day effect lasted a lot longer than it most likely should have. And so I believe that we now have a plan coming into the future. There are more holidays coming up, and we will have to address those at that time. Let me say this. In order to properly address all of the concerns that people have had, from traffic safety to ADA, because we've lost our major ADA parking lot in this storm, I have formed an informal working group of stakeholders beach users, concessionaires, private landowners, elected officials, in order that we can always have stakeholders at the table and in the conversation. I believe that this is an important lesson that we can all learn, that whether or not we all come to the same agreement, that we must always sit at the same table. And so I'm grateful to the Surfriders Foundation and organization that they will join me. May Nardone from Michael Mays and the main concessionaire will join me. Private landowners and Commissioner Chesney will join me and will help me bring folks from Port Aransas, and I will ask Mayor McComb to join me. And we will create together the conversations that unite us and not divide us. How are we to achieve anything in this pandemic if we're constantly battling one another? How are we going to defeat the real enemy if we're not united in keeping it away from us? This has been an unbelievable 4 to 5 weeks, not just for me personally, for the first responders, for the doctors and nurses, for our health department, and for all the people that represent emergency management. And while I express my gratitude for their unbelievable commitment, I want to thank the citizens for not only sharing with me their input and perspective, but reminding me that despite, quite frankly, unbelievable dissent, that's the most generous way I can put it, that courage is required to be labeled a leader. And I'm grateful for the courage of the city of Port Aransas, the city of Corpus Christi, and Nueces County have shown through this very difficult time. And as we have come upon our lookout point, I have looked out and I have seen that we didn't just flatten the curve, we bent it. But the fight and the struggle continues. And if we find ourselves in new tidal surge, I hope that you will understand why it is always important to make decisions that are based on data. Thanks so much, and I will be available by email or by telephone. I need to leave so that I can continue to work on these closures and get all of the things that we need to do to get into place for tomorrow morning. And also, one big shout out to Constable Bobby Sherwood, who knows what it means truly to hold the line. Thank you all.
Hemos estado trabajando arduamente para poder reabrir las playas después del daño causado por el huracán Hanna. La madre naturaleza tomó su curso. La orden actual continúa vigente en la playa hasta el 17 de agosto. Lo que no ha cambiado es que el virus aún no tiene cura o vacuna. Lo que hemos hecho para prevenir la propagación es seguir el plan del gobernador. Hemos restringido procedimientos selectivos médicos para así aumentar la capacidad en los hospitales. También se creó una clínica COVID. Regresando el tiempo, la tercera semana de junio, las playas estaban llenas de gente. A principios de julio se ordenó el uso de cubrebocas, se restringió el número de comensales en los restaurantes, se ordenó toque de queda y restricciones vehiculares en las playas, y esto ha ayudado a que se aplane la curva. Pero después ocurrió Hanna. La orden en las playas ha ayudado a aplanar la curva y se han salvado vidas. El resultado es la reducción del 27% en cuanto a hospitalizaciones. Los casos positivos han disminuido, así como el número de personas en cuidados intensivos. Desafortunadamente, el número de fallecimientos se encuentra en 277 personas. Voy a emitir una orden nueva el día lunes. El acceso vehicular en las playas va a restablecerse, pero con algunas condiciones, así como el toque de queda. Vamos a continuar monitoreando la situación y vamos a reaccionar conforme se encuentre la situación. Si va a la playa, hágalo de manera responsable. Mantenga su distancia y use el cubrebocas. Al igual cuando vaya a un restaurante o a algún establecimiento, le pido continúe practicando las reglas higiénicas. El mapa mostrado por la juez se encuentra en línea con información sobre entradas y salidas. El día lunes, la nueva orden y restricciones también estará publicada en línea una vez que haya sido firmada.
All right, good evening, everybody. It's almost 6 o'clock, so we'll do this as quickly as possible. My name is Dr. Chris Bird. I'm here on behalf of the CC, which stands for Corpus Christi, TAMU-CC, which stands for the University Task Force. Just reminding you that this task force is composed not only of members of the university, but also from the city and county, various doctors in the local community, and public health officials. The task force has two objectives. One is to answer your questions and address your concerns about COVID-19 and the interventions being taken place to try to stop the spread of COVID-19 in the Coastal Bend area. The second objective is to enable evidence-based decision-making so that we're not just using the seat of our pants, but also actual data to help to make decisions and make sure that the decisions that we're making are informed. Each week we start with what an outbreak is. So an outbreak is what we're in right now. It can be big, it can be small. It's a rapid rise in the occurrence of disease in an area. We have a rapid rise in the occurrence of disease in the world, which is the pandemic of COVID-19. And we have a rapid rise in the occurrence of disease in the local area, the Coastal Bend, and in Texas, and in the United States as a whole. So we're in an outbreak, in an outbreak, in an outbreak, essentially. COVID-19 is transmitted through the air, surfaces, and contact. And I know in the past there's been some debate. There was a paper published this past week that said that indeed COVID-19 can be transmitted through aerosolized particles. So it is truly airborne and not just in large droplets that you can see with your naked eye, but also in microscopic droplets that don't necessarily fall to the ground. And this was done by measuring testing for COVID-19 in the air in a hospital where you had COVID-19 patients where droplets couldn't possibly get to. So you can also contract it through touching surfaces and then touching your face or your nose or your eyes. And just in general, not protecting yourself from COVID-19. Over here, I'm not sure why the animation stopped here. We'll try to trigger it one more time. We have an example of how COVID-19 progresses. I guess the animation's broken, but essentially you go from 1 to 2 to a lot of people. That's a transmission rate of 2. Here we estimate that the transmission rate went up to 3. So 3 people were getting infected for every 1 person, and that was a lot of people. We'll talk about that a little bit coming up. Several interventions have taken place over the course of 2020 to address COVID-19. We had a stay at home, now it's stay at home if you can. It's still stay at home if you can. So if you can stay at home, you should. Social distancing and face coverings are now mandatory. You're supposed to self-isolate when you're symptomatic or when you come into close contact with somebody who tests positive for COVID-19. Contact your not your public health official, contact your personal doctor and go from there. You could also contact a hotline and request to get tested. School closures are something that have been in place, and now it seems as the school year starts up, there's some debate about what's going to happen with the schools. I think a lot of schools are going to online instruction, but some are also doing in person, depending on where you are in the country. I know I'm a professor at Texas A&M University Corpus Christi, and there are going to be some face-to-face classes starting there next week. And we went through a period of rolling back some of the restrictions that were in place. We went to Open Texas Phase 1, May 1st approximately, then Open Texas Phase 2, Open Texas Phase 3. Open Texas Phase 3 started somewhere in the realm of May 22nd, and then a month later it was repealed because at that point we had triggered this outbreak that we're in right now. So for that 1 month of Open Texas Phase 3, we've now been spending almost 2 months trying to stop it from progressing any further in that. So there's a cost that comes with opening things up. And we went back to even rolling back Open Texas Phase 2 partially. That's where we're at right now. The transmission rate in the Coastal Bend area, we've been showing you guys this. The transmission rate is for every person that gets infected, how many additional people do they infect? So right now we estimate that number is between 0.9 and 1.1. So the 1.1 should concern you. because that's an increase from our estimate last week, which was just 0.9. We're using 2 different models to make these estimations. The 1.1 comes from a model that uses cell phone data to predict what's going to happen in the future, and is indicating right now that our transmission rate is above 1. So what that means is that that model is predicting that COVID-19 could be starting to spread. It's a good time to remind you that what we see right now in terms of case counts, that's looking in the rearview mirror when it comes to infections. Infections happen 5 days usually before you become symptomatic. And once you're symptomatic, it's usually a few more days before you get tested and a few more days before you get the results of that test. So you're looking at a week and a half to 2 weeks in the past is the reflection of when you look at case counts now. What we were doing a week and a half to 2 weeks in the past determines what our case count is today. And when you look forward, then things start to, it's a little difficult to wrap your head around. So anyway, right now we're estimating this is transmission rate. So one person infects another person on average. After that week, another person's infected. After 3 weeks, another person is infected. And after 4 weeks, 5 total people were infected. Now this doesn't sound too bad, but that's only if you start with one person. When you start with a large proportion of the population, when I say large proportion, I don't know, 1% to 10% of the population that's infected with COVID-19, this becomes, a very large number of additional people that are getting infected. So we're not out of the woods here, and what we want to do is continue to try to force the case counts down. Remember, what we're doing today will affect the case counts a week and a half to 2 weeks from now. So these are 2 heat maps, one from the state of Texas and one from the local coastal Bend area, that shows you how many total cases there were. The brighter red it is, the more cases, and you're starting to see that all of Texas is becoming red. And that's because there's been a lot of cases across all of Texas. In the coastal Bend area, obviously Nueces County, with the highest population, has had the most confirmed cases. Something new this week from last week is B County is now has the second most confirmed cases, and San Patricio the third. And you can go down from there to the other counties in the coastal Bend area. I want to remind you that this report, it's for the coastal Bend once. That's how it's one way that it's different from the numbers that City Manager Zanoni presents. 2, we only present confirmed cases with a PCR test, not probable cases. The reason why we do that on the task force is to compare ourselves to other places in the state. The state is collecting data, presumably, at least they say, it's only PCR positive confirmed COVID test results, so that's what these numbers represent. The last thing you have to understand is that we get that data from Texas's databases, so the number you heard from Manager Zanoni today doesn't hit Texas's database until tomorrow night. So the numbers that I have right now were from a couple days ago. So with that, 17,700 total cases in the coastal Bend area confirmed with PCR tests, 10,400 recoveries, and 7,136 active cases. One more time, how could there be less active cases than what City Manager Zanoni said? Well, these are confirmed cases, so there's no probable positives included in that. And you might be wondering, what's a probable positive? If you go to the doctor and you're symptomatic and you get an antigen test or an antibody test and it comes back positive and the doctor diagnoses you as having COVID, that's a probable positive. A confirmed positive is if the PCR test comes back positive. So it's only PCR tests that we're going with to compare to other counties in the state. So overall, recoveries are moving in the right direction. The active cases right now still seem to have been roughly level for a little while now. The other thing to note is we've been through a wave already. This is our second wave or third wave, depending on how you want to count it. This is what the first wave looked like. You can't even see it anymore. It's just a ripple in the pond, right? And then we had some local outbreaks where you can actually see the line move a little bit if you really look at it. Remember, this blue line, it'll never come down. It's cumulative total cases. It can only stay even or go up higher. And then here's our Texas-wide outbreak where obviously it's been massive compared to anything that we experienced before this. If you look at the dates, it started right around Memorial Day weekend. And since that point, it developed. Starting June 26th, we started trying to do something about it up through today, and we continue to try to do something about it. The restrictions have gone up at the state level and have been in place for roughly a couple months. So this is a new figure that's built upon an old figure. We've been showing the positive testing rate at the mobile National Guard testing sites for the past several weeks. And that's the teal line here. The circles represent dates where there were tests taken. The bigger the circle, the more tests that were recorded. If you want to know exactly how many tests, we have a slide coming up to show you how many tests per day on average. And recently, the percent positive rate has gone down at these mobile testing stations. The reason why we show this data and not all the data together is that this data set is the one where we know how many negatives there were and how many positives, so we can calculate an actual percent positive rate. The other one, so this is the first time I'm showing this graph, these are all the tests done by the public health office or region here. And we also know how many positives and how many negatives there are. And you'll notice that this is at 27% right now. And you might be wondering, why is there such a huge difference between these two sources of data? Well, if you've been paying attention at the National Guard or state-run mobile testing stations, anybody was eligible to get a test. You didn't need an appointment. If you're asymptomatic, you could go and get a test. So what you're looking at is a different sampling of the population of the coastal bend when you look at this 9.7%. We don't know if it's a random sample of the coastal bend, but it's closer to a random sample than this. The 27% is coming from people are symptomatic. So they have symptoms that might be COVID-19. That's the prerequisite to get tested by the public health region. And then 27% of those people that had symptoms are coming back positive. So that's the reason why you see these differences here. I would say that right now, while it's encouraging that this is going down, realize that back here, not anybody could get a test. So that curve down, part of that is due to different people being able to get tests, people that are asymptomatic. But also we see a curve down here where there wasn't a change in who could get tested or who couldn't. So we are seeing a decline in the positivity rate in the coastal bend area, and it's not just due to a change in in who is getting tested. It's also because fewer people are testing positive. So that's moving in the right direction. This is from the same tests. It's just how many tests occurred on a 7-day average scale. And on average, there's about 204 tests being done per day over the past 7 days from these mobile testing stations. And then for the public health region, we're down to about 21 tests per day. And I know that there's a national story out there that Texas is testing less. To the best of my knowledge, the reason why we're seeing these declines is that fewer people are going to get tested. And it's not due to a limitation in the tests that are available. And if I'm incorrect, I'm sure that Public Health Director Annette Rodriguez will correct me on that. But we talked about it before, and we're pretty sure that that's what's happening here. There's no limitation on tests right now. How do we rank in terms of numbers of cases per day, per capita, which means per 100,000 people? Right now, we're around second place in the state, and this is not a good second place. This is the second place that we don't want to be in. Now remember, this is from a few days ago, and if you can remember the figure that Manager Zanoni put up, and I know that I memorized it because I would have to explain to you why this number looks the way it is, given the way his graph looked. Our data is from a couple days ago when there was that high number for this week and not the subsequent 3 low numbers for the rest of that week. And so it keeps it looking high. And we expect that this point will go down as we move forward. But still, even then, it's not going to get us down to where the rest of the state is at. And that's something that we need to keep looking at. Next, in terms of Texas as a whole, we break the state into public health regions. We're in public health region 11, South Texas. You can see that this is a good sign that we're going down. It's a bad sign that we're so much higher than all the other public health regions in Texas. If you look a little bit more closely, and what we've done is we put the names of popular cities in each of these public health regions here, but it's not just the cities, it's the whole public health region. So El Paso is trending upwards a little bit. Some of these other ones are kind of holding even, and then San Antonio has really experienced a large drop in the number of cases per capita. I don't know what they're doing there, if this is a data artifact or if this is a real sort of pattern, but if it's a real pattern, we should look at what they're doing and we should do maybe the same thing. I'm not sure what's happening there. In terms of South Texas, we're looking at some of the larger metro county areas in South Texas in this map, and they're color-coded. You can see Laredo is going up, but most of the other counties are going down. We're here in Nueces, and again, this will go lower with the next few days of data as it fills in. But we got a long ways to go before we come all the way down. Another thing to realize is, again, these are confirmed cases, not confirmed plus probable cases, so the shape looks a little bit different. In general, there's a good trend of downwards in the number of new cases per day per 100,000 people. If we zoom in on the coastal bend, so the other counties besides Nueces, we want to know what that looks like. Well, B County is launching. As far as I know, this is due to the correctional facility that's in B County. And really it's so much higher than all the other counties that we almost need to break out B and Nueces on there, put B County on that previous map, and then just look at the rest of the counties in the coastal bend area. But you can see there's some that are going up and some that are going down. In general, they're moving in the right direction. There's fewer names here this week than last week because so many are down here at the bottom that I couldn't fit them all in. Moving on to hospitalizations, and the way we move through this, we go from cases. Once you realize you have COVID-19, some people end up in the hospital, so we'll look at the hospitalizations next. This is how we compare to other counties or other trauma service areas in Texas. So the state of Texas is broken up into a number of trauma service areas. This number, it's 20-something, and we have the fourth highest number of hospitalizations per capita or per 100,000 in Texas, and we are moving in the right direction. We used to be number 1 in that. We're now number 4, but we want to be dead last. So while things are improving, we still have a long ways to go here. If we zoom in and look at the number of people in what we call med-surg beds, this is what the doctors call them. Med-surg stands for medical or surgical. And these beds are where you go if you get admitted into the hospital and you're not needing intensive care, but you do need to be hospitalized. It's a general hospital bed. The blue is representative of people in the med-surg beds that don't have COVID, and the red is indicative of people in the med-surg beds that do have COVID. And you can see there is this nice downward trend that we're seeing, but there's a long ways to go until we get to where we were at Memorial Day. And one of the reasons why I keep pointing this out, Memorial Day is really when this all started, what we're in the middle of now, and Labor Day is coming up in 3 weeks from now. So that's the next thing that we have to look forward to. And we don't want to party like it's Memorial Day on Labor Day, at least. We don't think that we're there yet. And for the ICUs, again, we have a decline, so that's good, and we expect this decline is going to continue, but realize that you can tell how stretched the hospital system is by looking at this plot. You have the non-COVID in blue, you have the COVID in red. Back here, this is about how many people are in the ICU at any one time, and it's about at 100, 150, and one of the reasons why this is the case is the hospitals really try to regulate how many people are in the ICU versus med-surg. And so you can look at it on average, there's about 150 people in our ICUs on any one day. Until this big COVID outbreak we've been in, now you can see it's being stretched well beyond its limit, above 200, even up to today. We're well above 200 people in the ICU in Coastal Bend hospitals right now. So we're stretching beyond the limit. Until this all comes back down with all blue filled up to 150, then we're not back to normal. Moving forward, this is a model. It's a red model that predicts what's going to happen in the future in terms of hospitalizations as a whole, ICU plus med-surg together. The red data points represent total numbers of people in the hospital in the Coastal Bend on any one day. And you can see that those points fit the model, or the model fits the points fairly well. We haven't changed the parameterization of this model for a month. So the settings that we put into the model a month ago, and it's simulating the pandemic as it occurs through time here in the Coastal Bend. It's really been able to track the number of hospitalizations, and so we think we have a firm handle on what's happening in the Coastal Bend area right now. This 453, it's the number that was predicted to be the peak number of people in the hospital, and it was a slight undershoot where we had a data point here. Realize this data point's actually the result of a data error that occurred when we switched from one reporting system to another, which I neglected to say that's what this line here represents also. So we went from the state reporting form to the federal reporting form so the White House can keep track of what's happening, and that caused some confusion on this day, resulting in too many people being reported. That wasn't really a jump. Okay, moving forward, some people that get hospitalized, they go to the ICU, and not everybody comes out of the ICU with COVID-19. So this shows how we're ranking in terms of numbers of fatalities per day over the past 7 days per capita in the Coastal Bend area versus the rest of Texas. And here we have a little bit of a caveat because the new way of measuring fatalities or recording fatalities, it's not based upon the report that we get today from Public Health Director Rodriguez and Manager Zanoni. It's based on death certificates, and the death certificates get analyzed by state officials, and it takes at least 2 weeks for them to be fully quantified. So because of that, this ranking is based on data from 2 weeks ago. And we go for 2 weeks ago, and then a week before that, that's what these rankings represent, because it's the only way for us to compare what's happening here versus the rest of Texas. And you don't have to take my word for it. You can see it right here. The bright red, this is the new recording system that the state is using, and you'll notice that it levels off. And these are a cumulative number of fatalities in the Coastal Bend area. And the reason why it's leveled off is not because fewer people are dying, it's because the death certificates haven't been processed yet. The brown is the number of people that have died in the Coastal Bend area. We're able to keep track of this because we're here in the Coastal Bend, in Nueces County, and we get these reports from the city every day about how many people have died. Now, this is the way the data was reported all the way back to the beginning of the pandemic. So you get at least a view of what's changing. So we're ending up with more cases on a particular day because when somebody dies, their death certificate doesn't necessarily get filled out and processed that same day and reported to the public health director. It takes longer than that. So you get some delays there. And then also it seems that at least in some cases, some additional people got counted or fewer people get counted depending on how it works. There's two sections on a death certificate. One are the direct causes of death, and two are related causes of death. The only people that get counted in these red circles had a direct cause of death being labeled as COVID on their death certificate. If it was a contributor or something that wasn't the primary cause of death, then it doesn't count in the new system. And as far as I know, the numbers that you hear from the public health director now fit those criterion. And she's nodding yes for everybody that can't see her. So hopefully that's clear. We expect these numbers are going to go up because the death certificates haven't been processed yet. So that's at 287 Coastal Bend fatalities right now. And as they get processed, it's going to go higher, unfortunately. This is our model again that's projecting how many fatalities we expect to see per day in the Coastal Bend area. The red points are data points. These red points, they're these red points. And so what I did was I cut out some of them here because they're just not being counted yet. You can see even here, we expect that these data points are probably going to increase as more death certificates are processed. What you can see overall is that there's a fairly good fit of the model to the data, and we expect that we're on the downside of the fatalities per day. And even though we've had a couple days here where there's been a fairly high number, on average, we expect that we're on the backside of this, and fatalities should decline. Okay, moving forward. So fatality is the ultimate end if you don't recover from COVID-19, but that's as far back as we can go. Now we want to look forward with the cell phone data. So we look at the cell phone data because if you get infected today, it's because of the behavior that you're engaged in today, and you might not figure it out until 10 days to 2 weeks from now. So this can tell us maybe what it's going to look like in the future. Okay, I know each time I show this, I know people worry about their privacy, and you should be worried because you're getting tracked. You're getting tracked by Google, you're getting tracked by Facebook, you're getting tracked by all sorts of companies. And if you have your GPS turned on, you're getting tracked. If you're connected to a wireless tower, you're getting tracked. And usually that data is sold and used to sell you things. Here, we're using that data. It's not identified down to individual level. But we can use it to figure out patterns of behavior in the Coastal Bend area. So one thing that we look at is leaving home and how many people are leaving home. It's here in the blue line. And that's been staying fairly steady or even declining a little bit. So in terms of how we're going to do in terms of leaving home in the future, what kind of effects are that going to have, it looks like leaving home is not going to contribute to an increasing transmission rate. With distance traveled, we've been on this steady decline. And again, these are the phases of Open Texas. And then here we started doing something. And then rolling back to Open Texas, what I call 1.5 up till present. So distance traveled on average has decreased. And then it's kind of leveled off in the past week. And so again, distance traveled doesn't seem like that's going to be contributing to an increased transmission rate in the future. And that's a good sign. We want to try to keep these where they are. We don't want them to go up. But these aren't the only indexes that we follow. Another one we follow is encounters. And encounters when two cell phones come near each other, and an algorithm is used to determine what the probability is of those two cell phones coming close enough that COVID-19 could potentially be transmitted, 6 feet or less. And what the cell phone doesn't know, and cell phones are really smart, right? But as far as I know, it doesn't know if you're wearing a mask or not. And it doesn't know if you put a bubble around yourself or not, if you washed your hands very thoroughly or not. It just knows if you come close to other people. Now, based on you coming close to other people, we've been increasing in terms of how many encounters we're having in the Coastal Bend area on average. And that's really increasing on the weekends. And this should be a reason for concern. And what you have to ask yourself is, are you doing the same things now to stop the transmission of COVID-19 as you were back after Open Texas Phase 2 was rolled back slightly? And if you are, and if all of us are, what this means is that the transmission rate is going to increase. And the only way that this doesn't mean the transmission rate is going to increase is if we're doing more to stop the transmission of COVID-19 when we're coming around those other people. So this is a reason for concern that we all should have. So not a good sign. And if you're wondering, does this really work? Here's Hurricane Hannah right there. It works. It really can tell how close you come to each other. The one thing I'll point out, we didn't go all the way back, but this was a higher encounter rate than we had during the middle of the stay-at-home. So during Hurricane Hannah, there were more encounters happening in the Coastal Bend than in the middle of the stay-at-home period. This is each county in the Coastal Bend, and it's the same metric, it's encounters. So if you look closely, just look at the curves. If you see an S, it means it's going up again from a low. And so here's Nueces, that's what we were just looking at, but now it's glued together, weekends and weekdays. San Patricio, B, and if you go back to right around here, this is Memorial Day. And if you start lining those up, you'll see that we're getting close to Memorial Day. And if we project this forward along the same trend by Labor Day, we're going to be where we were at Memorial Day. And that's something that should cause some pause and give you some concern about the behaviors that you're engaging in and what you're doing to prevent the transmission of COVID-19 when you engage in coming around other people. There's only a couple counties where they're not increasing: Aransas, Duval, and Brooks. Yeah, even Clayburgh's going up a little bit. So overall, across all of the counties, it's going up, and then even most of the counties themselves are going up except for a couple. Okay, now we go to essential and non-essential gatherings. This is essentially the same graph I've been showing with one exception. We've added a gaming category. This kind of popped up on our radar, and you'll see why it popped up on our radar here. This is a measure of foot traffic, and essential gatherings we're saying are visits to a home improvement store or grocery stores, if they're in the blue. Any line that's not blue, it's not essential. And there's been some sort of major launch in the activity that's happening at these gaming locations. I guess you can play poker there, or maybe I'm not sure. I thought gambling was illegal in Texas, but apparently there's some sort of ways around it that I wish I knew about before. But now we're in the middle of a pandemic, so maybe I'll figure it out once the pandemic's over. Anyway, something's going on there. But even if you look at malls, restaurants, and bars, the activity is increasing, so it's not what we want to see in terms of decreasing the transmission rate. Now, hopefully, this increased activity that we're seeing in foot traffic in these non-essential locations, movie theaters also tracking upwards, is associated with proper policies and following mask rules. It's very difficult to do that in a restaurant when you're eating, so hopefully you're outside or you're really far away from the other people that are in the restaurant. But this isn't a good sign that that's tracking upwards, because this is far from over where we're at right now. Last thing, schools. I know we're all interested in what's going on in the schools, and we're going to keep watching this. The professional and technical schools have been right around 50% of normal capacity in terms of foot traffic for a while now. They did decline from during the current outbreak. We're starting to see K through 12 traffic go up. We're starting to see junior traffic go up. And then the universities, which is TAMU Kingsville, TAMU Corpus Christi, and University of Texas Marine Science Institute, they kind of went up and maybe going down a little bit this past week. So we'll continue to watch that and see what happens. Recreational foot traffic at the beach. We've seen a decline, and then maybe in the past few weeks, a slight increase in foot traffic at the beaches. In terms of other outdoor activities, parks, other museums tracked upwards for some reason, but now they're going back down. One person suggested maybe this increase at museums was due to damage because of the hurricane, and there were crews that were trying to repair some of our museums here. Okay, and then one other thing we can look at with foot traffic is how many people are coming to the coastal bend. So what we've done here is we've been able to determine how many times a restaurant was visited by a device that lives outside of the coastal bend area. We've done that week by week. That's what this plot represents. It's in thousands, so we've got 64,000 visits to restaurants in the coastal bend from devices that live outside of the coastal bend this week. So how does this work? If you're from outside the coastal bend and you go to breakfast, lunch, and dinner at a restaurant, you get counted 3 times. That's 3 visits. That's how it works. About 10% of people are being tracked, so we multiply the numbers that we get from the cell phone service by 10 to come up with the total number of visits. And it comes from all over Texas. It's amazing how the cell phone technology can let us see this. The other thing that you'll note is there has indeed been a decrease over the past few weeks since the vehicle restriction at the beaches was put into place right during this week. And we're at the lowest amount of traffic at the restaurants that we've seen from outside the coastal bend since we've been starting to look at this metric. If we look at the other direction, where are we going to? And I've seen some national articles this week saying that we're traveling too much, not just in the coastal bend, but all over the country to really help contain the pandemic. In the past week, or no, August 7th to 9th, it's not even the past week, there were 97,000 locations outside of the coastal bend that were visited by people from inside the coastal bend. If you look at this heat map of the US, as you go up to more red, you have more estimated visits. As you go more towards blue, you have fewer estimated visits. But make no mistake that we're going all over the country, potentially bringing COVID with us or bringing it back. So this is something to be cognizant of when you're traveling. Okay, getting to the end. In summary, The Texas-wide outbreak isn't over. So I think it's getting more important to emphasize that. We've become so desensitized that when we only have 90 new cases in one day, that it's kind of like, oh, that's a lot less than 400 or 300. But there was a time when it was unthinkable that we would have 90 cases in one day, and that time was right around Memorial Day, when the summer was starting. So COVID-19 cases, they're declining slowly in the Coastal Bend area. Our indication is still, if you go off those active cases, about 1 in every 10 Coastal Bend residents is infected actively. The way we get to that is the CDC estimates that for every positive test, there's actually 10 people that have COVID-19. So if there's 6,000 active cases, there's actually 60,000 active cases in the area. COVID-19 ICU usage and fatalities should be declining. They are declining, and that's the good news. The bad news is that the transmission rate estimates are now creeping up above 1. These are cell phone enabled estimates. At least here, this 1.1 is a cell phone enabled estimate of the transmission rate. The 0.9 is based upon our cases, new cases per day. And so when this starts transitioning from below 1 to above 1, that's when we start to expect to see an increase in the number of cases in a week and a half to 2 weeks. The cell phone data is predicting an increased transmission rate. If you look at the number of encounters, if you look at our non-essential visits to places like restaurants and gaming centers and movie theaters, all those things are ticking upwards now. And it points to increasing transmission rate in the future. It's not time to relax right now. The way this pandemic is going to work, it's not going to be over next week. It's not going to be over a month from now. As far as we can tell, it's not going to be over in 2020. So we've shown that what we've done over the past month or so, or 2 months, can really help to decrease COVID-19. And as soon as we stop doing that, then COVID-19 is going to start increasing again. And I think that's the important thing for everybody to realize. So how do you help contain the outbreak? If you own a business, I don't think I have to tell you at this point, but COVID-19 is bad for business. And so if you have policies at your business that promote the spread of COVID-19, you're kind of hurting yourself. You might be getting short-term gains, but you're looking at a future, maybe another stay-at-home period again, which isn't going to be good. We want to avoid those things from happening. So no shirt, no shoes, no mask, no service should be the type of policy that you have in your business to promote longevity. Next, you want to close the loopholes in your social distancing policies. COVID-19 is out there. If there's a hole for it to get through, it will. That's how we got in the situation that we're in now. It's not a new thing for people to wear masks, and I see kind of week after week it's becoming more and more accepted for people to wear masks. We slow down COVID-19 by wear your face covering when you're outside in public. I watched Dr. Fauci last night when he's running, or he runs 4 miles a day. He said when he's out running, he puts his mask like this, and if he sees somebody coming, he does that. All right, so that's the type of thing you could do if you're going outside. It's okay to go outside. You don't have to stay inside. You just want to stay away from other people. And this is an analogy that I've been wanting to make. But it's like the movie where you can't make any noise, otherwise, the bad, aliens or something are going to get you. The Quiet Place, which was pretty, famous recently. We're in a horror movie, if you will, but the Quiet Place didn't get it quite right. It's not that we can't stop talking, and we love to talk. It's that the thing we need the most is to be near other people. And that's the thing that's so insidious about COVID-19, is that it's kind of taking away that thing that we need to be near other people. And that's the hard thing, not being quiet so much. So anyway, that's the challenge here. Social distance. Try not to get as close to other people. Self-isolate when you're sick or exposed. Stay at home if you can. Wash your hands. Soap is better than hand sanitizer. For those of you that don't know it, soap will really destroy the virus. You scrub your hands for 20 seconds, and the molecular makeup of soap actually breaks apart the sheath of the virus and just completely destroys it. avoid social gatherings, curbside and takeout still a good idea, and support testing and contact tracing. This image here shows you what it looks like if you wear a mask and you sneeze, sing, talk, or cough over the top of these Petri dishes, which have a medium that will incubate bacteria. And you might say, well, yeah, COVID-19 is not a bacteria, so why does this matter? It matters because those bacteria got onto these plates over here where no mask was worn through droplets that came out of the person's mouth who was doing these things, the same droplets that would transmit COVID-19. Masks work. As long as you put them on, it doesn't work like that. All right, I'd like to thank everybody on the task force and remind everybody again, the task force is made up of more than just people at the university, although they're an integral component. There are doctors, public health officials, people from the city and county that also help every week to bring you these presentations and give you the best information we can about what's happening with COVID-19. So with that, I think we'll have a translation and then we'll take a couple questions from Facebook Live.
En cuanto al virus, este puede transmitirse mediante el aire, en el ambiente, mediante contacto con superficies y por contacto humano. Se han implementado intervenciones para evitar el contagio, incluyendo quedarse en casa cuando sea posible, distanciamiento social, autoaislamiento cuando existen síntomas, el cierre de escuelas para evitar contacto, así como la reapertura en el estado para reactivar la economía al reabrir negocios. Actualmente, de acuerdo con los datos más recientes, nos encontramos en el nivel de transmisión más bajo que se ha visto desde el mes de mayo. Esta semana, el segundo condado con el mayor número de casos positivos es el condado de Bee, seguido por San Patricio. En el área de la costa, la cual cubre 11 condados, se cuenta con más de 17,700 casos positivos comprobados, o sea que no incluye los casos probables. Recientemente, el porcentaje de casos positivos ha disminuido y la toma de especímenes también ha decaído. Cada vez es menos la gente que requiere la toma de una prueba. Actualmente, el área de la costa es la segunda en el estado por número de casos positivos por el virus y estamos en la cuarta posición a nivel estatal en cuanto a hospitalizaciones y el número de fallecimientos. En cuanto al número de encuentros cercanos entre personas, este ha aumentado. El estudio con teléfonos celulares indica que durante los fines de semana los encuentros entre personas ha sido mayor y esto puede provocar la mayor transmisión del virus si una persona está infectada. El número de casos por el COVID ha estado disminuyendo en nuestra área. Se estima que el número de fatalidades también vaya en disminución. Los estudios con teléfonos celulares predicen que el radio de transmisión puede aumentar, por lo que es importante no bajar la guardia y continuar tomando todas las medidas necesarias para disminuir la propagación.
All right, thank you. We'll take questions.
Just like Dr. Bird said, we have a great team. A few of those members of the team are on Facebook and they field questions during the Dr. Bird's presentation. So a lot of questions did get answered today. There's very few of them to ask. These questions here you can answer, and probably Annette would want to answer a couple of them too. Are there enough tests for people who request them?
I'm going to let Annette come down and address that. I have a microphone, so I can just stand off to the side here.
Okay.
I didn't touch the podium.
So the question is, are there enough tests to actually get a COVID test if you needed one?
Yeah, if they request them.
Yes, there are. And the good news is, I just got a text a few minutes ago, we had 0 people request a test for COVID-19 today. This is the first time we have gotten no people requesting to get tested since we started in March. So, but there's plenty of tests.
Okay, good. Is there enough testing being done in general?
In general, there's plenty. So we knew them as the military testing team. They're still available. They're still testing. We are testing. The urgent care centers are testing. So there's still a lot of testing availability currently if people need to get tested.
And does the wait list for the testing still exist?
I have no wait list, so I'm happy to say there is not a wait list for the health districts. So I would venture to say the other places don't have a wait list either.
All right. And lastly, is there going to be on-site testing at the schools?
On-site testing at the schools, that's a great question. And you know, the schools are still developing their processes. September 8th is right around the corner, so That's what I did most of today, was fielding questions from a lot of the superintendents. And so they are trying to figure out if that's something that they're going to have available or how we're going to work that if they do have positive cases, but I don't know that answer at this time.
At Texas A&M Corpus Christi, I know they're planning to test students there at the very least. But I know the question was probably for K through 12.
Yeah, it didn't specify which schools were, but that's good to know as well. Okay, and then lastly, on a little lighter side, Dr. Bird, what's your favorite Prince song?
Purple Rain.
Okay, good deal. And thank you.
Thank you.
Okay, that concludes today's briefing. And I'm here on Annette's here if there's any other additional questions that the media might have. We good? Okay, let me give you the lineup for the next couple of weeks. So tomorrow, I mean not tomorrow, but next week we're going to do the same lineup because we're doing extensive budget work events with the City Council. We're in the process of having the City Council review the proposed budget that I presented to them a few weeks ago, and ultimately Council has to adopt a budget, and that's scheduled for September. So we're doing work sessions with the Council and virtual meetings with the community to get community input on the budget. So next week there's a lot of evening meetings with the community and with the Council as well. So we're going to keep the schedule that we have this week, which is Tuesday and Friday briefings. Is that right? Is it Tuesday and Friday? Monday, for the, no, for COVID, the COVID briefings, Tuesdays and Fridays, right? Yeah, so Tuesday evening will be live here at 5 o'clock, and then Fridays they'll be dedicated to Dr. Bird. But this week coming up, Dr. Bird, it's Thursday. Okay, so this week coming up, next week coming up, it's going to be not Friday, but Thursday evening. Thursday at 5 will be the briefing from Dr. Bird. Okay, so Tuesday, myself, the mayor, Nueces County Judge Barbara Canales, Annette. And then Thursday will be Dr. Bird. So none on Friday next week. And then we'll get you more information next week, but we're going to change that up again where Dr. Bird, because of his schedule and the ability to get data, we're going to swap those dates. We're going to have Dr. Bird present on Tuesday evening, and then the judge and the mayor and others will present on Thursday. Okay, so we'll get you more detail on that after or during next week. So next week, Tuesday, Thursday. Thursdays, Dr. Bird. Tuesdays, mayor and judge and others. And then we'll get you more detail next week. Okay, that concludes our briefing. Be safe this weekend and remember the protocols. Thank you.